RNIB, supporting blind and partially sighted people.
Community Views, accessing eye care services. This video uses actors to speak the words of community members gathered in an RNIB commissioned research study. This research study was conducted by Shared Intelligence.
Almost 2 million people in the UK today are living with sight loss. Every day, 100 people start losing their sight. 50% of this sight loss is avoidable.
My name's Celia, I'm 45 years old and I'm from Hackney in London. Out of all the senses, it's the one I've missed most. My sight is incredibly important to me. Imagine not being able to see colours.
My name is Aftab, I'm 45 years old and I live in Bradford. If you didn't have your eyes, you wouldn't see the beauty of life or the colours of life.
I'm David Allen and I'm Head of Sight Loss Prevention for RNIB. Prevention of avoidable sight loss is one of RNIB's key strategic priorities. And in 2011, we commissioned some qualitative research to identify the barriers to access for primary and secondary care amongst particular target populations. The research is part of a much wider programme of work looking to identify key issues for target communities in Bradford, Hackney, Glasgow, Cwm Taf in South Wales and in West Belfast. What we found from this research was that there was a sense of fatalism amongst the community. They didn't really understand much about eye health. There was very limited community awareness. And worse than that, there was a misconception that they couldn't do anything about protecting their eyes.
My name's Mary and I'm 63 and I'm from Belfast. For me, eye health is about whether you need glasses. You have to accept what God gives you.
Losing sight always comes in time. If it's going to happen to you, it's going to happen to you.
People tend to think that sight loss isn't avoidable and that if you have a sight problem, it's going to make you go blind. We need to challenge this misconception. What was interesting about the research was it didn't make a difference if someone had had an eye test or not as to how much they knew about eye health.
There are no posters or leaflets to show how to look after your eyes. They should have some sort of course to say how to take care of your eyes. Or they should have a professional coming into the community centre to give information on eye care.
My name is Derek, I'm 65 and I'm from Rhondda Valley in South Wales. There's a lack of awareness around eye health, so not taking preventative measures to look after your eyes is the biggest problem. The only thing you hear about is contact lenses or laser treatment.
I'm Ali, I'm 41 years old and I'm from Glasgow. Much is talked about lifestyle factors, but it isn't fully explained for people to make a change. I get letters from the dentist all the time about checkups, but nothing from the optician. It's human nature, we don't go to look after ourselves until we're told.
So what we found out was that eye test attendance is symptom driven, and that of course means that early detection is much less likely. One of the barriers we found is the retail dimension of optometry. People feel under pressure to buy glasses when they do go. They often ration their attendance because they can't afford to go very often. And they viewed the eye examination as a completely different type of intervention to other medical health checks. That's going to have an effect on the treatment that people are going to be able to receive. Most people go in because they think they need to get glasses.
People do go to the opticians, yeah, but when they go, they only get told that they need more glasses.
When I can't see, I'll go. I only get tested when I'm having trouble.
It's difficult to get out of work an eyes appointment. You make do with what you can afford rather than what you need or want.
Too much pressure to purchase glasses. Too much emphasis on selling expensive designer frames. I postponed my eye examination to manage my costs.
Your eyes are worth it. Sometimes you have to save up, and if other things are needed, then you would have to wait.
Personally, I think it's a money-making thing. Even when your eyes are okay, they're still trying to offer you things to buy. I saw a show on TV that said to make glasses cost 30p. I have to pay £300.
A lot of people also spoke about having a really positive experience when they go to the optometrist. And what we found out was that developing trust between the optician and the individual was really important in them wanting to come back again and again. It put people at ease, making them feel comfortable, making them feel like it was a valued experience from both sides.
The staff are nice and polite. The optician gives you time.
I was quite impressed because I do an eye check every year or so, And the optician was quite young, but she referred me to Moorfields Eye Hospital for a second opinion, and she was clever because she was right about needing more treatment.
Yeah, I like my local optician. They do diagrams and explain it all.
In 2 of our sites, we focused on diabetic retinopathy, and in 3, we wanted to look into a bit more detail around glaucoma and the issues surrounding it. The research showed us that managing diabetes is really hard work for people. They struggle to keep track of the different appointments that they've got. Sometimes they're not even sure what appointment they're going to and why. And in some cases, they didn't even know if they'd been to an appointment. People with diabetes didn't understand the difference between diabetic retinopathy screening and going for a standard eye examination. It can make a real difference as to whether other eye conditions are identified and treated.
There is a link between diabetes and eyes. They're like 2 sisters. If we knew the how and why, we could protect ourselves. The community's diet makes control difficult. Fried food and sweets.
In my circle, people don't know about the links between diabetes and eye health. No one really considers watching the sugars to protect their eyes. Asian people don't associate that, the link between diabetes and eye health. They don't understand the importance of it.
Many patients find the eye care system to be fragmented and confusing. And sometimes people are taken off hospital lists if they don't attend appointments. And of course that can lead to even bigger problems and people going blind.
I was in Pakistan and I let Help Service know this, but I still got a letter saying that I did not attend.
You need a text message to remind you about the appointment, otherwise it's too difficult. I have to wait a long time often, a lot of waiting. And people often leave because they cannot wait any longer. It's a lot of waiting. You don't always see the same person every time at the hospital. That'd be nice, but that's how it goes.
Didn't know anything about glaucoma. Would have liked a bit more information about treatment options and scenarios.
A poor patient experience and lack of information are going to be barriers to accessing eye care services. But on the other side, a much more positive patient experience and continuity of treatment are going to enable people to engage much more effectively.
I had a very professional service at RGH. The surgeon took me through all aspects of the procedure and made me feel very comfortable.
My optician did have to console me and tell me not to worry too much. Glaucoma was not a case of automatically going blind. She did take pains to calm me down.
We would like more support, but we don't know what's available.
For more information about the research, please visit rnib.org.uk/health professionals or email professionals@rnib.org.uk.
RNIB, supporting blind and partially sighted people.
Copyright of RNIB, May 2012. Registered charity number 226227.